And I'm very happy to have with me my friend and our local doctor that knows it all when it comes to skin, Dr. Timothy Jochen. And I asked him to come in today to talk about a topic specifically because recently I had a scare with one of my children in regards to skin cancer. And I never, ever would have suspected it in a teenager. You know, it's something that you think of as later in life, and I became educated very quickly. Fortunately, my son is fine, but I became educated very quickly about it. And so I wanted you to come in and talk a little bit about how this is not just a disease of when you get into the older years.
That's correct. Now, it's more common in older people, but we do see it in younger people. And people that are more prone to it are going to be lighter skinned people, particularly if you've had sunburns in the past or if you have a family history. And some people actually have a genetic predisposition to getting skin cancers.
Well, that is really frightening. So what can a parent do, and especially if they have no idea, what can they do?
Well, you know, if the nice thing about skin cancers is they're right there for you to see. So if you see any unusual marks, things that aren't going away, spots that bleed, spots that are darkening, you want to get into a dermatologist and have those evaluated because they could be a skin cancer, even in a young person like your son.
Yeah, and see, mine popped up in just a regular sports physical, and it was, and he's never really had a sunburn because I always slathered on the sunblock, and you know, but he is fair, so it was a very educational experience, but frightening at the same time.
Yes.
And one thing that his physician had pointed out to us was the fact that we live here in the desert, so that's also something to add to the mix, correct?
Exactly, because you know, being in the sun is what really increases your risk. You know, you want to stay out of the sun, you know, avoid the peak hours of sunshine, and particularly avoid indoor tanning, because a lot of people like to do the indoor tanning, but it can increase your risk of developing cancer by 2.5 times.
Okay, now talk about this though. You have teenagers that always want that glow. What are their options if they shouldn't be tanning inside and they shouldn't be outside, you know, basking in the sun?
Yes, I wish I could change their perception because I think every skin type is beautiful. But for those people who really believe that having a glowing tan is the way to look more attractive, I think doing the spray on tans is a good option for them.
And why are they healthy? Because I would just be curious, aren't there chemicals in them that maybe one day we're going to say, oh, those chemicals are bad? You
know, the chemicals I don't think are that risky. You know, the chemicals that they use are not that dangerous. They've been proven to be pretty safe. But the risk of those, I think, is so much lower than the risk of getting tanning, either from a tanning bed or from sun exposure. So I would definitely take that risk, which is minimal compared to getting sun exposure, which has been proven to be very dangerous.
So the bottom line for teenagers as well as parents today?
You know, avoid the sunshine, protect your skin, look for unusual marks, have them evaluated by a dermatologist if you find them.
All right, I told you, and here's the dermatologist to talk with. I told you he knows it all when it comes to skin. Thank you so much, Dr. Timothy Jochen this morning.